I'm Katie Neese. I'm the Deputy Assistant Secretary here at the Office of Special Education and Rehabilitative Services. A large and growing body of research from studies in the United States and around the world has demonstrated a significant relationship between mental health and academic performance in children and adolescents. These studies have found that children who experience mental health problems are more likely to have unfavorable education outcomes, including poor grades, delays in reading, grade repetition, thoughts of dropping out of school, and lower educational attainment than their peers without mental health challenges. Secretary Cardona recently highlighted both the need and the opportunity for student emotional, social, behavioral, and mental health. He said, in the past, student access to structured mental health services in schools hasn't been implemented in a functional way. It's been ancillary and after the fact. We have the opportunity now to redesign schools and make sure mental health services are a part of every school's DNA. The funds provided under the American Rescue Plan can be used to realize this opportunity and help states and districts integrate social, emotional, and behavioral health services and supports into what schools and programs do every day. To build back better, we must intentionally integrate the current research and evidence on the importance of prevention and intervention practices to address the mental health needs of children and students. This should be done not just as a reaction to COVID, but as a deliberate action to address fully children and students' overall well-being and to support their full access to education. And now you'll hear from 3 communities that have made a real commitment to student mental health.
Hello, my name is Angela Dunn. I'm a clinical social worker and the behavioral health coordinator for Kansas City, Kansas Public Schools. I recognized many years ago, when I was the clinical director at our local mental health center, that hundreds of students each year were being referred for mental health services, but very few of them were showing up. We were only seeing 30% of the students referred actually come in for an intake evaluation, recognizing that there was lots of barriers to this. There's stigma around mental health, there's transportation barriers, there's insurance challenges, and also just a resistance to seek help at an outside agency. So at that time, in my position, I developed a school-based therapy program and saw great results. We were serving students at school, where they are, where they're learning, at the convenience of their family, and breaking down some of those barriers. Our intake to evaluation rate went from 30% to over 60% just by providing services at the school where the children were. 4 years ago, I was hired by the Kansas City, Kansas Public School District as their behavioral health coordinator to lead our mental health social workers in our schools. We have at least one behavioral health social worker in all 46 schools, with 2 or 3 in some of our middle and high schools to meet the specific behavioral health needs of our students. Nationally, around 20% of children experience a behavioral health disorder. With the onset of COVID, we know that those numbers are much higher. We see a lot of students exhibiting externalizing behaviors, such as aggression, yelling, kicking, throwing, but some of them are internalizing their stressors. They might be quiet or shutting down, experiencing depression, not doing their schoolwork. And when we have mental health professionals in all of our schools, they're able to recognize those needs of the students, they're able to talk with teachers about their concerns, and then connect them with resources. Unfortunately, those resources are challenging to access. There are wait lists at our mental health centers. Private therapists are no longer accepting new clients, but our students still have a need. So with these funds, we were able to start an after-school mental health clinic free of charge for all students in our district. We have 2 locations, Schlegel High School and Harmon High School, which geographically are able to meet most of our families. We wanted to share this opportunity with our families, so we created a brief video highlighting this opportunity to be able to share with them. We recognize that students have mental health needs that might reach beyond what we're able to provide at school. And sometimes there's barriers to accessing those services in outside agencies. And so we wanted to give students an opportunity to receive those services within our district after school. So we have 2 care clinics open on Tuesdays and Thursdays at Schlegel High School and Harmon High School for any student in the Kansas City, Kansas Public School District from 5 to 7. We have trained mental health providers available to provide some counseling and therapy interventions free of charge to students, and then connect them with resources that they might be needing after those services are completed. So if a family is interested in services for their student, they would contact the social worker or the counselor at their school to schedule an appointment. Mental health doesn't have to be this big, scary thing. We just want you to know that we're here and you can come and we can process through whatever struggles you're having with you. With this funding, we're able to have skilled clinicians on site at both locations to serve our students. We're also able to have a welcomer, someone who greets the families, completes a brief assessment, and provides them with resources that they might be needing. Other things like custodial staff, a police officer on site, and after-hours crisis are essential, and we're thankful to have these funds to pay for those services as well. Students can come in and meet with a trained professional for an evaluation and free therapy sessions to work on coping skills, regulate their emotions, and sometimes even work with parents and families on things they can do at home to support their students. Again, this is free of charge, and the providers are then, after a few sessions, able to connect them with outside resources if the family is willing. We see students kindergarten through 12th grade at the mental health clinic after school and have seen a variety of presenting problems. Sometimes students are coming in with issues related to behavior in the classroom, and so the clinician is able to work with them on specific skills to improve their focus, improve their behavior, and some behavior management skills for the teacher or the parents to utilize as well. We also see students who are coming in really overwhelmed. They've missed school, they've been online, and are now trying to get caught up. And so working through that anxiety and that stress with students, being able to provide them those self-regulation skills and coping skills has been really helpful. We know that in our community, students also experience a great deal of trauma and complex trauma. Sometimes we can't dive into that in just a few sessions, but being able to work through body regulation and decrease some of those triggers and worries can be helpful, and then we can refer them to a professional for long-term treatment. Suicide is the second leading cause of death in children ages 12 to 20. We have completed over 520 suicide assessments just this school year in Kansas City, Kansas Public Schools. Our social workers are assessing children daily, and when they have concerns and the family is willing to receive those services, we connect them. However, sometimes the family is resistant, but the social worker is able to talk with them about receiving services after school at the mental health clinic. This is a great connection to get the child what they're needing, but also seek outside services for a wraparound approach to get them the treatment that they need. We're able to see that families appear more willing to access therapy services at school because it breaks down that stigma of going to an outside mental health agency. They see it as a connection to the school day, and parents we've talked to seem to feel more comfortable coming there to access services. It's been really great to see the students coming in, the progress that they're making, parents reporting that things are going better at home and at school, because we know that if a student is well, both physically well and emotionally well, they're going to be better able to learn. We assess other needs that they might have as well, such as resources, lack of housing or food or transportation, and these social workers and counselors are able to connect them with those resources as well. Mental illness doesn't discriminate, regardless of someone's race or socioeconomic status or where they live. They can experience these symptoms of a behavioral health disorder. We're so thankful to be able to have this resource to offer our families so that we can serve as many students as we can to improve their ability to function in school and to be successful. We know that if we have happy, healthy, safe children, we're more likely to have happy, healthy, safe adults in our community. Our students deserve this, and our families deserve this, and our community absolutely deserves this. Thank you for this opportunity to share the passion and commitment that Kansas City, Kansas Public Schools has to supporting and addressing student mental health.
Good day. My name is Tia Marie Brumstead. I serve as the Deputy Assistant Superintendent for Health and Wellness at the DC Office of the State Superintendent of Education. I'm thrilled to be here today to discuss how we in the District of Columbia are maximizing our COVID-19 recovery funding to support our school-based behavioral and mental health efforts. First, I'll tell you a little bit about OSSE, which is the Office of the State Superintendent of Education. As DC's state education agency, OSSE works urgently and purposefully in partnership with education and related systems to sustain, accelerate, and deepen progress for DC students. Within OSSE, I work with the Division of Health and Wellness, and we believe that healthy bodies and minds are the foundation of academic success. And our division leverages programming, partnerships, policy, and data to remove health barriers to learning so that people of all ages and backgrounds are prepared to succeed at school and in life. So for today, I'm going to focus on the work that OSSE, in partnership with our State Department of Behavioral Health, is doing to support school-based behavioral health. I'll begin with an overview of the District of Columbia's comprehensive school behavioral health model. Within this integrated system of care, we are working to develop a coordinated behavioral health system that creates positive school culture, promotes mental wellness, and provides timely access to high-quality services for children, youth, and families. We are working to ensure the delivery of educational, prevention, early intervention, and intensive services, which many of you know as a multi-tiered system of support to support students' positive mental health and healthy decision-making. And this model utilizes a public health approach as its organizing framework. To support us with implementing a comprehensive school behavioral health model, we have to have a strong school behavioral health workforce, which we have made significant investments in. The workforce consists of school-hired or school-funded social workers and professional counselors, with school psychologists and school counselors also having a critical role in a multi-tiered system of service delivery. Our workforce also includes school-based providers who are employed by the Department of Behavioral Health, as well as local community-based organizations. And these providers work with our school-hired providers, complementing services that are already offered to students and families. And they work within this existing service structure to create safer and supportive school climates. And also, these providers work with our schools to offer supportive services for teachers and staff, which may include professional development. We are grateful for the significant recovery funding available to further support our comprehensive model. These timely and targeted investments will allow us to move our community from recovery to restoration. We will also continue to develop and expand our existing workforce, our behavioral health providers, our educators, and our school leaders' ability to support students in need. And these multi-year investments will be infused throughout our entire school behavioral health system, so to sustain themselves once our funding is depleted. I'll first discuss our recovery investments and promoting mental health and well-being. Mental health is a part of overall health, and students must be healthy enough to learn and teachers healthy enough to teach. We know that universal approaches help to decrease stigma about mental health and illness and create a trusted adult culture where students, staff, and families are informed on how to seek help from the start. Our two primary investments in this space using our recovery funding include suicide prevention education and professional development. So with suicide prevention education, the district has contracted with 2 vendors that provide evidence or research-based suicide prevention curricula for our elementary, middle, and high schoolers. And as the state education agency, OSSI hosts quarterly training sessions for school behavioral health providers and other related staff, such as deans of culture, special education coordinators, to learn about the curriculum and receive an overview on how to identify student warning signs of depression and suicide, how to respond to disclosures from students themselves or from peers that are reporting on behalf of a friend, and how to train additional trusted adults in the building. And this investment will allow OSSI to train at least one staff member from every public and public charter school, as well as provide the curriculum to every public and public charter school over the coming years. We've also invested in professional development focused on supporting youth with depression and anxiety, and we are expanding our existing community of practice for school behavioral health providers, which will enrich these already powerful collaborative spaces for the next 2 years. And OSSI has expanded our work on supporting the wellness of educators by creating a 2-year technical assistance program where community-based experts in workplace and educational wellness are going to partner with schools to support school teams with identifying and responding to sources of educator stress and improving organizational structures to help minimize burnout and increase job satisfaction. OSSI has also invested in both student and school leader-facing targeted interventions. In the 2022-23 school year, OSSI will begin facilitating additional training in evidence-based trauma-informed group interventions. And these offerings will consist of trauma-informed coaching and an overview of student-facing group curricula, as well as supplemental implementation support for school behavioral health providers once they have identified a student group caseload and are ready to begin the curriculum. And next school year, we will also bring technical assistance opportunities for school leaders and school crisis teams. We will be focusing on our largest school districts and on our public charter schools that are newly opened since the 2019-2020 school year or the beginning of the COVID-19 pandemic. And this opportunity will provide participating schools with support to help them update or enhance or even create their school crisis protocols, as well as their crisis prevention and intervention activities. And any resources that are created through this technical assistance opportunity will then be housed with us as the state education agency and made available to any interested school in the future. And lastly, our recovery investments will also support Tier 3 or intensive service availability at a few of our schools, at 6 schools in the district. We will be implementing the High Fidelity School Wraparound Program, and this program will provide connections to care between the school mental health team and medical, social service, and community partners for students and families with the highest need. And so again, we will be implementing a high fidelity school wraparound program in 6 of our schools with demonstrated need. So we, again, are well positioned to seamlessly integrate these recovery investments and utilize our existing data collection efforts to measure the impact of these investments alongside our system-wide investments. And we can do this in partnership with our Department of Behavioral Health, with our local education agencies, schools, and community partners. And our assessment will be informed by 4 system-wide data sources. The first is our annual school health profiles. So the school health profiles captures school-reported data on a variety of health and nutrition topics, and included is the identification of the types and numbers of school behavioral health providers, as well as the types of behavioral health-related programming and professional development happening at each school. This also includes the schools reporting on how they are supporting the wellness of their educators. We are also going to be able to measure student, staff, and family attitudes and experiences with school behavioral health through school-level climate surveys and our district-wide Strengthening School Behavioral Health Survey, which the district began administering in 2021. DC also administers the Health and Physical Education Assessment in certain grades. Scores provided here give us information on student knowledge on related health education content that's aligned to our health education standards, and this includes social and emotional health. And lastly, DC middle and high school students participate in the biennial Youth Risk Behavior Survey that is offered by the Centers for Disease Control. All DC middle and high schools are required to administer this survey to students, which provides robust insight into the health risk behaviors among our youth. So thank you for allowing me to talk about our existing and our recovery initiatives here in the district, again, in partnership with our State Department of Behavioral Health, our LEAs, and our schools and community partners.
My name is Dana Ashley, and I am the director of the UFT's Positive Learning Collaborative in New York City. I want to thank the Department of Education for recognizing that the social emotional well-being of our children and our educators is key to academic success. I invite you to take a moment to imagine with me. Imagine a world where we as educators had the tools and strategies to meet every child exactly where they are academically, socially, and emotionally. Imagine a world where schools are designed to encourage creativity and connections. And imagine a world where every child's unique energy is channeled in the direction of joyful learning, and their unique backgrounds are affirmed and integrated into their educational experience. This is the world that the Positive Learning Collaborative has worked since 2013 to bring about. PLC emerged from the realization that systemic racism and school disciplinary practices had created a system of exclusion for children of color, LGBTQ children, children with learning disabilities, and immigrant children. The COVID-19 pandemic has highlighted and exacerbated the disparities in our school communities. It's more important than ever that we devote ourselves to disrupting the system that has caused these inequities and provide the resources needed to build strong, connected, and trusting schools in which all staff and students can heal and flourish. PLC is not a one-size-fits-all model. We weave the strategies of restorative practices, trauma awareness, yoga mindfulness, social emotional learning, all under a framework of equity. Our goal is to shift the mindsets of educators away from punishment and towards empathy. Through professional development, direct classroom consultation, team and administrative coaching, we help them develop relationships where adults truly get to know their students and foster community so that students learn to understand each other. School communities thrive when the relationships inside them are trusting and safe, when we don't assume why a child is behaving a certain way, but instead we ask them what they're feeling and what they need. When children feel respected and valued, and educators support and respect each other, schools thrive. At PLC, we have a team of behavior specialists supporting every school, both on-site and virtually. It is this type of support that makes change sustainable. We work together to assess and address their needs, from self-care to culturally responsive pedagogy for their teams. We have 25 schools currently in our full participation model. However, thanks to the funds provided by the American Rescue Plan, we have been able to take our work to a whole new level, scaling our impact and experimenting with different approaches that can guide educators across the globe. I'd like to share a little bit with you now on how we've used the American Rescue Funds. At PLC, we teach and coach healing-centered practices. So during the pandemic, we developed a webinar and learning groups in which we developed a professional learning session to over 10,000 educators, focusing on simple strategies to incorporate into daily practice to assess and respond to stress in students and self. These skills helped cultivate a healing-centered environment in classrooms and give educators tools to identify students who may need additional support. Our next project was our sensory tools for schools, which we're really proud of. We flooded over 500 high-need schools with sensory toolkits for every classroom, outfitting over 13,000 classrooms and therapy rooms with age-appropriate sensory tools to help students be ready to learn after returning from the traumatic interruptions brought on by the pandemic. Please check out our video.
I use sensory tools throughout my classroom often. I'll see if somebody feels uncomfortable or if they're having a hard time, and if there is a tool, I'll talk to them and explain that they have a tool and how to use the tool appropriately. I had a child who is moving a lot, fidgeting. They want to learn, it's just at this point they also want to move. If they have the band, at least their feet can be busy. What's good with the wiggle seats is sometimes there's a bumpy side, so they're able to move back and forth and still tend to task. The biggest thing with the headphones is if there's a lot of noise outside and either they can't concentrate or it's too much and it's hurting their ears, the headphones really help them focus into what they're supposed to be doing. The beanbags help because it's flexible seating. So pretty much instead of sitting in your chair, a lot of the time, some children, they just don't want to sit in a chair the whole time. At least they get to sit in the beanbag chair. A lot of students have been learning many different ways. They've been learning at home. People have been in school, out of school. Now everybody is coming back into the school building. So I feel like sensory tools will actually help them throughout the course of the year because they'll learn that if they want to move, they're not going to be able to get up and go to the kitchen like they were before, but at least they could sit and have some sort of movement in their classroom seat.
The prevalence of anxiety is escalating across all student populations. A classroom with appropriate sensory tools can help children feel secure in their physical space and promote self-regulation. Students can't learn if they're upset, distracted, anxious, or overstimulated. Aside from helping students focus, the use of certain sensory tools may heighten awareness, provide a sense of security, comfort, improve creativity, and promote mental and physical relaxation, even decrease crisis. Please check out our data from our Sensory Tools project. Another really important project that we focused on with our American Rescue Plan funds was our culturally and historically responsive education framework partnership with Dr. Goldie Mohammed, the author of Cultivating Genius. At PLC, we constantly evolve with the needs of our schools while staying true to our vision. So it made sense to us that in addition to our training and coaching in community and restorative circles, mindfulness and yoga, crisis intervention, and bringing sensory tools into schools, that we integrate culturally responsive practices in all of our work. Together with Dr. Goldie Mohammed, we added a year-long series of workshops and coaching in culturally and historically responsive education and social emotional learning for 50 schools. We are hopeful to expand this project beyond just the 50 schools in the future so that all New York City students have the opportunity to attend schools where they can flourish and grow, schools where they see themselves in the curriculum, that they feel valued.
The first impact, I may think it's small, but it's huge. Like we have to work small to move large mountains, is that sense of awareness through identity, right? How we see ourselves, how others see us, and how we see our community. And what's interesting about our school community, our children have been in this community for quite some time. Their parents have been here, their grandparents have been here. And we're the outsiders coming in to see what is happening here. So it's imperative upon us to know what we're walking into and to build a deeper community beyond the surface level of, let's have a community festival night. Let's change our mental models, right? How are we really impacting children? How are we setting them up for success for the future? That's our thought. Like, how do we really work that, do that magic, right? Because that's what it is. It definitely brings a new and needed dynamic and perspective to educating all children, right? Once you see it, you can't unsee it, right? Our children have the unique opportunity to see themselves across content when we think about true culturally and responsive education, right? And to build the intentionality behind the work is what truly inspires the work, right? To be intentional about what we're doing. Like, we're going to match up our new reading curriculum to our SEL learning and merge the two. We're going to ensure that the children that are in front of us are being represented as well as ourselves so that we build that true community. And we are working diligently to be inclusive in all experiences. We have a unique opportunity and partnership where we get to reimagine our schoolyard. And we were intentional about how many males, how many females, how many students of color, how many students of disabilities are going to be on that planning committee, how many English language learners. And to watch them today, they had their second trip and they're actually planning the yard, and to see them working together and having those deep conversations about, no, we should have a soccer field over here and a basketball court over here because, and no one was worried about who they were. We were Community School 111 as a collective. So that was awesome to see. The first thing that comes to mind when we embed this well is a constant feeling and sense of joy, right? That I'm part of a bigger community. It's more than me, it's about we. How do we impact generations? How do we build those lifelong learners, those critical thinkers, those children who question what we chose to read and what we didn't choose to read today? Who's being impacted by the stories we tell, the stories we're not telling, right? When our school has truly embedded CRSE into our curriculum, now we're impacting families. So now we will have that more inclusive community. Parents and other family members are going to want to know, what are you doing over there at Community School 111? How can I be a part of that? How can I stretch it beyond these four walls and we really go into the community? So we want to think about it, sustainability across or beyond our pre-K through 8 school. How are we impacting our community?
The work that we have been able to do in our culturally and historically responsive education framework, partnership, as well as the sensory tools and the growth of our teaching and coaching of healing-centered practices in our schools has been instrumental in helping students really cope with the trauma and stress that they have experienced during the pandemic, as well as educators. We are really grateful for the opportunity to do this work with our schools, and we hope to be able to continue doing more of it in the future. Thank you so much.